Good afternoon, everyone. I'm Lisa Crockwell with the Newfoundland and Labrador Association of Social Workers, and along with my co-facilitator, Pam King-Jesso from the Association of Registered Nurses of Newfoundland and Labrador, we wanted to welcome you to this education session titled E-Professionalism and Practice in the Digital Age, Ethical, Legal, and Practice Considerations. And what a timely topic for a professional practice discussion in 2015. You know, as associations for social work and nursing, the NLASW and the ARNNL has worked together for quite a while, actually, since 2004, organizing and facilitating education sessions for all health professionals. So this is actually our 12th session that we've facilitated together. And while this event is co-sponsored by both of our organizations, we also want to acknowledge the support of the Memorial University School of Nursing for this event as well. And you know, throughout the years since we began, we've really tried to focus our topics on ethical and practice issues which are relevant and which are timely, and based on the types of consultations that we receive at our respective organizations. Oftentimes situations where there's a lot of professional judgment involved, where the answer is often not clear. And this year is absolutely no exception in this topic. Also, throughout the years, we've had the good fortune, I believe, to bring together just stellar groups of people on our panels who've lent their time and their expertise to us to reflect on the topics that we've chosen throughout the years. And certainly in 2015, this year is no exception as well. So we're here at the main auditorium of the Health Sciences Center, but we're also accessible by webcast throughout the province. So just a note, if anyone is attending by webcast and you're experiencing any difficulties, just know that this production is going to be on the websites for NLASW and the ARNNL in the near future. So our goal, because we're on webcast as well, is to bring together health professionals no matter where we reside, and to have really good up-to-date information and present, best practices and provide a context where, as individual professionals, we can take the information, we can have some examples, and we can apply it to our own practice, whatever that practice may be and wherever it may happen. So for that reason, we've got a format of presentations, case scenarios, and an opportunity for questions toward the end. So we will have a question and answer period. And the email address for the question and answer period is going to appear at the bottom of the webcast screen, and it's educationwebcast2015@gmail.com. So to our topic. E-professionalism and practice in the digital age. So e-professionalism, in the context we're going to talk about it this afternoon, is a term that encapsulates professionalism within the parameters of online communication. So we all know that digital technology challenges us to think about how we communicate, but e-professionalism goes beyond communication or online communication, and involves our whole online persona of an individual based upon the meaning of all of our online interactions. So that could include blogs, images, videos, tweets, all of it. And it's essentially how we portray ourselves to the world, online particularly. And as professionals, we need to stop and pause, I think, in terms of, is our online persona congruent with the values and ethics of our respective professions? And just think about that personal and professional boundary that exists there. Additionally, we all know that our clients and our patients have a digital presence as well, and we need to be asking ourselves the questions, what do we need to consider when our digital lives intersect? So as health professionals, we've got to both understand the technology, but we've also got that responsibility to use it wisely from that frame of mind. Anyone who attended the Eastern Health Ethics Day last week, which focused on social media, will know that was kind of a predominant theme that we found that arose during the day. And increasingly, this whole theme of e-professionalism is a topic for discussion in professional faculties and schools, and I think we have some students in different health profession faculties that may be here with us at the Health Sciences, but I know are attending by webcast. And they have various surveys and various ways that they deal with it. And many universities have something similar to the University of Minnesota, which has a social media survey that invites students in health profession faculties to reflect on at least one aspect of their professional lives, and that's their presence on and use of social media. So I just want to start us off by sharing some of the comments and questions that the University of Minnesota asks their students. And they graded on a Likert scale from strongly disagree to strongly agree. So just think about where you may rest on that scale, and if you agree or disagree with some of these statements I'm going to share with you. So first is the age comment. They ask, younger adults, ages 18 to 24, willingly share too much information about themselves via social media. So sitting here, do you agree or disagree with that? What I post about other people online is a representation of myself. They ask, people should remove comments or images from their social networking sites if someone else strongly believes they are offensive or incorrect. I can control the information that is available about me on the internet. Outsiders, whoever they may be, should not be able to use information posted on individuals' social networking sites. And finally, another question they ask, it is inappropriate to friend my patients or clients on social networking sites. So as you ponder those questions and we start our discussion this afternoon, I now have the pleasure of introducing our stellar panel who are going to be exploring all the dimensions of e-professionalism with us. And I'm going to start on my far left and introduce to you Elaine Borg. Elaine is a legal advisor with the Canadian Nurses Protective Society. She received her undergraduate degree in nursing from Queen's University at Kingston, Ontario. She worked in the infant neurosurgery unit at the Hospital for Sick Children in Toronto prior to focusing on her main interest, obstetrics, which she practiced at Mount Sinai Hospital in Toronto and the Ottawa Civic Hospital. Her interest in ethical decision-making led to a position on a hospital clinic ethics committee, and from there to a career in law after graduating from the University of Ottawa's Law School. Elaine is a member of the College of Nurses of Ontario, the Registered Nurses Association of Ontario, and the Law Society of Upper Canada. She was on the working group that drafted the National Disclosure Guidelines published by the Canadian Patient Safety Institute, and she was on the Advisory Council for Queen's University's Masters in Healthcare Quality. And Elaine's joining us from Ottawa today, and she braved the weather and got here, so welcome, Elaine. And braved it from Ontario, I have to say, even before she got here. So we're glad that you're here in person, Elaine. Second, I'm going to introduce to you Tammy Coffey Hickey. If you'll notice on some of our flyers that went out, Molly Butler was to be an initial panelist, and she was unable to be with us today, and we're very grateful to have Tammy with us for sure, and we really appreciate that she's here today. Tammy Coffey Hickey is a registered nurse, and since 2010 has worked as a professional practice consultant for nursing with the Professional Practice Department at Eastern Health. In 1990, Tammy graduated from St. Clair's Mercy Hospital School of Nursing with a diploma in nursing and subsequently completed both Bachelor of Nursing and Master of Nursing degrees from Memorial University. Tammy has held a variety of positions over the years, such as staff nurse in critical care and clinical educator in both the critical care and medicine programs. Tammy holds a CNA certification in medical surgical nursing and is a professional associate at the Memorial School of Nursing. So welcome, Tammy. Next to Tammy is Sandy Hansel. And Sandy is a former director with the Office of the Citizens Representative for Newfoundland and Labrador. And prior to this, he held a number of senior positions with the access and privacy field, including senior research and outreach advisor for the Office of the Privacy Commissioner of Canada, the Assistant Information and Privacy Commissioner for the Province of Newfoundland and Labrador, and Director of Access to Information and Protection of Privacy with the Provincial Department of Justice. Mr. Hounsell was responsible for creating and establishing the first comprehensive access and privacy regime for the province of Newfoundland and Labrador, and he also provides counseling services in the areas of access to information and privacy. He has a Bachelor of Applied Science degree from Ryerson Polytechnic University in Toronto, a Master's of Business Education from Memorial, as a Fellow of the School of Graduate Studies, and he's now also an instructor with the Law Society of Newfoundland and Labrador's Bar Admission course, and a recipient of the 2001 Service Award of Excellence. And finally, I'll introduce to you my colleague at the Newfoundland Labrador Association of Social Workers. Annette Johns is our Associate Director, and she's been working with us since 2004. And prior to her position with NLASW, she held several positions in community practice, including Program Director with the AIDS Committee of Newfoundland and Labrador, and was Executive Director of Planned Parenthood of Newfoundland and Labrador. Annette has a Bachelor of Social Work degree and a Master of Social Work degree from Memorial University. And her professional interests lie in social work ethics, social policy analysis, and social work regulation. And in terms of social work, Annette was the lead author on the documents Social Media Use and Social Work Practice for the Canadian Association of Social Workers. Also the lead author for the Standards for Technology Use in Social Work Practice for our province, and recently worked with an international task force representing Canada to develop international standards for technology use in social work practice. So welcome to all of our panelists. I'm looking forward to a great discussion, and I am going to turn the podium over now to Pam, and we'll get started on our event.
Okay, welcome everyone. As Lisa mentioned, my name is Pam King-Jesso, and I am nursing consultant at ARNNL. So thank you to our presenters for coming today, who will no doubt provide some very interesting perspectives on e-professionalism and practice in the digital age. So I get to do the rule part. We have a very tight time frame today, so I will proceed to give you an overview of how the next 2 hours will play out. The teleconference is divided into 4 sections. During the first section, each panel member will have around 10 minutes, during which they will provide some general information about e-professionalism, and including any relevant information about their organization and areas they represent. After that, the panelists will spend around 40 minutes discussing 2 case scenarios. Following the case scenarios, we may have a few minutes then to entertain some clarification questions, which you can ask to our panelists. Of course, our clarification questions, due to timing today, are going to be limited to the scenarios presented and/or the information shared by the panelists in their introductory remarks and during the case study. For those participating via the web, you can send your questions, as Lisa mentioned, via email at educationwebcast2015@gmail.com. During the final minutes, our panelists will then give concluding remarks, and we will pull it all together. Now, to assist with planning for next year's event, there is an evaluation form in-house, and there are also evaluation forms available online. So we'll ask you to fill those out and, give us some ideas of topics that you would perhaps like to hear about next year. Just for the registered nurses who wish to utilize this session for continuing competency, you can register online and you will receive a certificate after you register and complete the online evaluation. Registered nurses who are here today and who are participating in-house can certainly come up after and see me to get their certificate as well. Social workers attending this session may claim 2 CPE credits under the workshop category as per the NLASW Continuing Education Policy. Before we proceed, now just a short note that this is not a debate and there will probably be more questions than answers. The primary goal here today is to raise awareness about e-professionalism and practice in the digital age. Today's discussion is intended to provide you with general information only and cannot be relied upon as legal advice. and the lawyers asked me to say that. Laws and policies change over time and differ from province to province, and in some aspects, certainly between disciplines. Applicability of the principles discussed may differ in individual situations. All health professionals, we all use our own professional judgment when deciding what to do in actual situations. And of course, if you require legal advice, you should consult a lawyer. However, we do hope that the information you learn today will be shared with your colleagues in a spirit of learning. I also want to inform you that this session, as you see, is being recorded today and will be available for your viewing at a later time as well. As it is being recorded, we'll just ask you during question period to be cognizant of what information, of course, that you share during your question period. So now that we have all those formalities underway and discussed, I'll move right along now to our panelist and ask Annette Johns to come forward to start us off today.
Good afternoon, everyone. I just want to start off by acknowledging the fact that technology use in general continues to evolve and expand. And the first picture you see is the electronic typewriter. And I remember getting that typewriter when I was in grade 10 in high school. And I just thought I was in heaven because my typewriter had the autocorrect function that the typewriters at school didn't have. And I was amazed by this modern piece of technology. Remember texting in the old days. Our only concern was that a teacher or a classmate would see what we had written on that private piece of paper that we didn't want anyone else to see, only our friend who we were forwarding it to. And of course, many of us fondly remember and still do use what is now referred to as vintage social networking mediums. Our Rolodex for professional contacts, our address book for sending letters to colleagues and friends, good old paper and pen for writing our thoughts and ideas. And these are gradually being replaced by online social media platforms such as Facebook, Twitter, Google+, Skype, Instagram, online chat rooms, and the list goes on. So it's inevitable that this growth in technology would start to have an impact on us as personally, but also professionally. And that, web of technology that we're connected to is so accessible even at our fingertips. This is a graph that I came across looking at the whole network of social media sites, and I'm sure there's many there that are missing. So basically, social media is a term that captures online technology that enables people to share information quickly, immediately, with contexts that are provincial, national, and even international. And it differs from traditional internet usage in that it encourages social dialogue and immediate communication rather than just data storage, which was, I guess, when we look at the origination of the internet. So, of course, this diagram speaks to the diversity and volume of social media platforms that exist. And even if we're not using them currently ourselves, I'm sure that you know people in your networks who are using a variety of different social media platforms. For many individuals, social networking is part of their social being. As you can see evident from some of these cartoons. The first one, I now pronounce you husband and wife. You may update your Facebook status. How people really, everything is shared online. The next one relates to a Twitter. So I've broken up with Jim. Really? How could he cope with it? He doesn't know yet. Twitter's down. So just that they were cute cartoons that are really indicative of the fact that social media has become so pervasive in our lives. And approximately 82% of Canadians use social networking, so that's quite significant. And those of us who have grown up in the digital age are often referred to as digital natives, where some of us who are new to online technology, we will be referred to as digital immigrants. The next slide that I have really gives us a good idea in terms of how we're judged by our online presence, which is really getting at the heart of what we want to talk about today. So the young girl is saying to the superhero, if you're so super, why don't you have a Facebook fan page? So it's almost like people need to prove their worth through what they have on social media. And it really leads into our discussion about what our online presence says about us as individuals, but also as professionals. So the more context we have on social media sites and the different social media platforms that I showed you earlier, is the greater likelihood that our personal and professional lives will cross through these different platforms, and that the information that's available about us online is actually quite accessible than it ever was before, and people who we don't even really know or who are our true friends has access to that information. So this cartoon skit is saying he had over 2,000 Facebook friends. I was expecting a bigger turnout at his funeral service. So if you look at the 2,000 who this person supposedly thought were friends on Facebook, just imagine that network actually went out much further than that. So more than 2,000 people, we can assume, would have access to this person's personal information. So as social workers, nurses, and other healthcare professionals, we exist in private, personal, public, and professional spheres in our lives. And of course, we're all familiar with the word professionalism, which really speaks to how we portray ourselves not only in the workplace, but also includes characteristics such as our integrity, judgment, and trustworthiness. And as professionals, we're accountable to a code of ethics and standards of practice, and we strive for ethical behavior and professionalism in our practices. But the internet and changing landscape of digital technology is certainly changing how we view professionalism in practice. And I came across this term recently on E-Professionalism, which I thought was a really great way of capturing in terms of our professional presence online. So E-Professionalism had a quote here from McAuliffe and Chesnoweth, I believe I'm saying that correctly, but basically e-professionalism is the development of an online persona that is congruent with the values and ethics of the professional and portrays use of self in a way that is respectful and demonstrates professional integrity. And I really like that definition because it goes beyond in terms of how we communicate online, but it's also how we exhibit online, how we can look at our trustworthiness, the honesty, and the integrity. So while one may argue that our personal life is private and doesn't warrant public scrutiny, the internet is challenging our thinking around that because with the advancement and growth of online technologies, nothing online is ever private. And this is not how social networking is set up. Social networking sites are set up to encourage social dialogue, instant communication, sharing. So we might post something one day and it's gone viral in a matter of seconds. And also there's no expiry date on anything that we post online. Even if it's deleted, it could be recovered by someone at any other time, including when we use pseudonyms. We may think that we're being anonymous, but again, that is information that people can find out about us. So we started with some reflective questions. I also wanted to get you thinking about some other questions as well, particularly for those of us who use social media. So do the comments, posts, and photos that I post online reflect how I want to portray myself as a professional? Do I have my privacy settings set to the highest level? What information is available about me online? Have I ever been tagged in a post that I felt was inappropriate or one that I was uncomfortable with? Have I ever talked about my work, being clients, colleagues, or my organization on a personal social media site? So I just want you to take a few minutes to reflect on those. And even if you aren't an active social media user, there's still maybe information available about you that can be accessed online. So if you have families and friends who are taking pictures and posting them and including your name, you can be tagged that way. So there might be a lot more information available about you than you even realize. So as social media use continues to grow, as professionals, we must examine this technology within the realm of professional practice and ethics, particularly as it relates to personal and professional boundaries, self-disclosure, dual and multiple relationships, privacy and confidentiality, and informed consent. And it's within this framework that I'd like to provide some comments on. However, I want to begin by saying that while we're talking about e-professionalism here today, healthcare professionals have always had to balance personal and professional issues in practice. running into a client at a birthday party or at the grocery store and they ask your opinion on something, having a relative who's a close friend of a client, having your child attend the same class as your client's child, clients knowing about your family life and upbringing because they grew up in the same community that perhaps you did. And in rural communities in particular, this is the norm for many healthcare professionals that they have to navigate every single day. And I'm sure this resonates with many of you who are attending online today from rural and remote areas of the province, and we can certainly learn a lot from your experience and your expertise and strategies that you've developed in navigating some of these rural issues. So in terms of social media, some of the examples of ethical dilemmas that we often get consultations on or that has come up through the literature include how to handle friend requests from clients or former clients, deciding whether to seek out client information through social networking sites, whether to post information related to our work or information about clients on a Facebook page or a blog or other social media site, clients accessing your online profile and gathering information that you wouldn't normally disclose to a client. So we know from some of the research that clients are actively seeking out information on their healthcare provider as well. Finding out that a client is a friend of a friend on Facebook. We've seen that one. A client posts information about their experience with a professional or organization. Or a colleague posts online content that you believe to be offensive or inappropriate. So as you can see from the list that's on the slide, if you look at key areas for ethical consideration, they're not new issues for our professions. Only the medium has changed to create what we call virtual boundaries. So I just want to take a quick minute just to kind of look through some of these in terms of related to self-disclosure and boundaries, for example. It is important that we consider what we may be revealing about ourselves through social media and who has access to the information. So it's not only clients, it may be potential clients, our colleagues, our employers. And does our social networking profile portray a different persona than we would like to be viewed professionally? And how might this reflect negatively or positively on your profession? So that's an area where we need to think about and have some dialogue on as colleagues. In relation to privacy and confidentiality, we also need to be attuned to client privacy and confidentiality. So how might a client's privacy and confidentiality be impacted, for example, if we accept them as a friend on Facebook? And even if we post information online that doesn't identify a client, in particular, this may not be enough to protect client confidentiality. Clients can be identified by case details, geographical information, and organizational specifics, even if the person's name is not used. In relation to conflicts of interest and dual relationship, a dual relationship is defined as any relationship a professional might have with a client outside the professional, whether that be business, social, or personal. If we accept a client's friend request on a personal social networking platform, is this now a dual relationship? I would argue that it is, as it extends beyond the professional. In relation to informed consent, it's important that clients are aware of your professional social media policy and that of your organization. And having that conversation with a client up front in terms of I don't accept friend requests on Facebook and so forth. And whenever you're navigating some of the ethical complexities, there's 3 questions that I think would be helpful as you reflect on whether or not there are ethical considerations that you really need to be reflecting on. 1, would I feel comfortable documenting it? 2, would I feel comfortable defending my decision or action publicly? And how would my colleagues react? And I'm going to conclude, because I know my time is up and I have so much more information that I do want to share, that when we look at all these ethical issues, we really need to consider the continuum of boundaries in professional practice, from encounters, crossings, to violations. So receiving a Facebook friend request, for example, will be an encounter, similar to running into a client at the grocery store. Our response to this encounter is critical and requires thoughtful consideration. So how do you respond in a way that's thoughtful, respectful, but doesn't contravene your code of ethics, for example? Online self-disclosure may fall within the parameters of a boundary crossing. So a client learns that you're excited about an upcoming family trip to Disney and views pictures of your children with their airline tickets. This is not likely to be harmful to your client, but it's still a form of self-disclosure and a boundary crossing. However, other forms of self-disclosure may be quite harmful and fall more along the continuum of a boundary violation. So, for example, a client sees a negative post that you've written about your employer and he or she questions the level of service that they are receiving. You are critical about the work of a colleague that your client has also seen. A client sees intoxicated pictures of you and your friends on Facebook and they're seeing you for addictions counseling. Another example of a boundary violation will be the posting of client information, identifying or not, on a personal social media platform, which again are public forums, or developing an online intimate or romantic relationship with a client. So I will stop there. I do have some risk management strategies to share and how you can manage some of those ethical risks that present through social media, and I will share those later on. So I'll turn it back to Pam.
Thank you, Annette, and thank you for highlighting, the importance of reflection when we work as healthcare professionals in this digital age. And we look forward to hearing more about your risk management strategies as we talk about the cases. So I will now ask Sandy Hounsell to come forth with his presentation. And I'm going to ask my colleague, as I would be defined as a digital immigrant, according to Annette, so I'm not very good with changing all the slides and doing two things at one time. So my colleague, Siobhan Lewis, is just helping me. Thank you.
Thank you, Pam. Welcome, everyone. It's great to be here. I enjoy these sessions because I think it's very valuable information. I will say in my 10.5 minutes that I've been allotted, I'm going to try and get as much in as I can, but what I want to do is I'm going to just talk in general about social networking and also provide some real-life examples. So I will be using some photos. I will say that I did go outside the province to pick the photos, so hopefully no one in the room will show up on my slide deck. But if you do, I certainly don't apologize for that. But at any rate, the title of the session, and I've always used this term, that social networking is a public expression of private matters. And I think that says a lot in terms of we feel we're doing things privately, but in fact may very well be doing them publicly. And just, I've thought a lot about this, about today's privacy landscape and exactly where we are and what we're doing. And I've looked at all kinds of literature and all kinds of debate over what today's privacy landscape is. And the one thing that I came across, which I thought best described where we are today, was actually a cartoon. And this cartoon says, "Is my dad ever going to laugh when he sees himself on YouTube?" Because that's the world we live in today. We are living online. We are living in a very public, I've been in that situation on the couch, and I'm sure my kids have taken photos of me, but hopefully they haven't posted them. I started a Facebook account just to follow my daughter, just to see what she was doing, and then she defriended me. So I'm not sure now what's going on. But I'm trusting that she's listened to some of the things that I've said to her over the last few years. But again, it's just this world that we live in now is so different than what it was a number of years ago. We're so much more public now in what we do. So we have all of these social networking sites out there. I talk quite a bit about Facebook, but there are a number of sites other than Facebook that really apply here. And these are just a few. There are so many. My kids are telling me now about sites that I've never heard of before. There are just so many different ones that they're involved with. I want to start by just giving you a couple of statistics, which I think are quite telling. Right now, Facebook has 1.35 billion users. All right, if we put that in perspective, if Facebook were a country, it would be tied with China for the most populous country in the world. Right, so that's a lot of people. There are a lot of people that are using, and this is just Facebook. So the numbers are quite amazing. 864 million people log on every day. All right, so that's what that's the audience that you're part of. There are 300 million photographs posted every single day. Right, that's the photos that we post. Some people take every photo they take, they post it. So that's a lot of activity, a lot of material that's being posted. there are 4.5 billion likes every day. So even if we're not posting photos, we're liking sites, and that tells the world a little bit about you. You know, what sites are you pressing like? There are 5 new profiles created every second. Right? So that just gives you the staggering amount of information and people that are involved in all of this. This is a quote from the Social Workers Code of Ethics, and all of the social workers in the room will be very familiar with this because you're all very familiar with your Code of Ethics, required reading. Social workers strive for impartiality in their professional practice and refrain from imposing their personal values, views, and preferences on clients. It is the responsibility of social workers to establish the tenor of their professional relationship with clients and others to whom they have a professional duty, and to maintain professional boundaries. You've heard that word boundaries used already today. You'll hear it again before the day is out. And that's a very important aspect of everything that we're doing here. Imposing your personal values. Every single time you're on a social networking site, you are imposing your values to the people that have access to that site. And in some cases, you know, hundreds of thousands and millions of people will have access to that. So it's something that's very important to keep in mind. This was an article that I came across back a couple of years ago. It's a little bit dated, 2009, from Boston College. It's written by a social worker. And I still use it today because it's some of the things that he says in this article are very relevant. So what I'm going to do is I'm just going to pick out a few quotes that I thought were very important. If your profile on a social networking site reflects a persona different from the one you portray at work or in the community, maybe you should reconsider its content. So what you're doing out in the community as a professional is one thing. What you're doing at home in your private life and posting it online could be very different. If your profile could negatively affect your image as a social worker, it will interfere with your ability to do your job. Right? Something to think about. Social workers should not solicit private information from clients unless it is essential to providing services. Conversely, have you ever considered looking up a client on a social networking site? And I can guarantee you that a lot of people have done this. Employers are doing it all the time. So if you're looking to advance your career, I can guarantee you that over 80% of the time, the prospective employer is checking you out on your profile and your social networking activity. Social workers should not engage in dual or multiple relationships with clients or former clients in which there is a risk of exploitation or potential harm to the client. Right? Again, quote directly from that article. Social workers are valued members of their communities and often are looked to as role models. I mean, often the clients you deal with look to you as a role model. So we take this picture, which is a couple of social workers. There's no caption here, right? And the reason there is no caption, because I don't think there needs to be a caption, right? This type of a picture says a lot. It's a couple of people having fun, probably quite innocently, snapped a picture of themselves, posted it online, right? So now if you just think about that kind of a photo, you know, appearing in the hands of the clients that you're dealing with, what kind of image is that portraying? You know, is that your professional image? It's not for me to say, but I mean, you need to think about whether that's the type of photo that you'd like to have out there. And this I picked right off the internet, and there was a story that was attached indicating that there were a couple of social workers, and that was the whole intent of that story was to explain how these 2 individuals posted this and it ended up on the internet. This was another case that happened recently, and it was a social worker that was sanctioned by the Health and Care Professions Council. This particular social worker had been dealing with a family that had gone through a very nasty custody battle. And the social worker actually had to testify in court. And during her testimony and after her testimony, she posted online, I guess, a play-by-play of what was happening. And she said some fairly derogatory things about the parents and talked about how wonderful it was now that the kids were finally going to have a better, or go to a better place. She didn't say any names or anything like that, but she did provide detail about the case, and she did explain where she was. In other words, what court she was testifying in, and actually had a map of to the court attached to one of her posts. right? So this is a situation where the parents of the child involved found this, saw this, and were very upset that these comments were being made. So this particular social worker was actually sanctioned and disciplined for that activity. Here's another recent case where this is a nurse. I think this was Switzerland, I believe. No, sorry, this was New York. This was in New York. The nurse was actually fired. What happened is in New York, there are quite a few subway accidents. And in this case, the subway, a gentleman was hit by a subway car and ended up in emerge. And what happened is, as you can imagine, the emergency room was absolute chaos. After everybody had left, there was a photo that was taken of the emergency room with the blood and everything all over the floor and the mess that was in the room, and was posted through Instagram. And the caption under the photo was "Man versus 6 train," right? So it was a number 6 train. The lady here, the nurse involved, of course, posted that through Instagram and was fired because of it. Interestingly enough here, she didn't even take the picture. It was one of the doctors that took the picture and shared it, and then she shared it. Right? So again, you have to question the professionalism in these types of things. I found this one very interesting. This received a lot of public attention. You may have heard about it. This was a young nurse. Here's her name. Her name is there for the world to see. And she had just done her first circumcision. And this was her comment. "Did my first circumcision on Friday. Watch out, boys. Here I come." Right? Again, is this something that you want your professional persona to include? And there was a lot of controversy over this. This was in the news. It was in the media. And her name, of course, will forever be attached to this particular story. And I don't think that's something that she intended when she posted, but it certainly happened. Here's another example of, this is a nurse in the UK, and she had posted online, she was advocating for euthanasia, and she felt that all gingers and the elderly and people with bad toenails should be euthanized in order to cleanse society. Right? Also, if you go further into her website, she had a picture of Hitler. So there was an association with Nazism. So this became, again, a very public story. This one received a lot of media attention as well. I don't know if you knew about this one or saw this, but this was in the media quite a bit. Here's a nurse. The person in the bed is someone that had recently died, and the nurse decided that she was going to post a picture of herself with the body. And the caption said, "Guess she is sleeping or dead. Hint, I am soul taker." She went on to say, "Yeah, their time is up. Gonna send them to hell where some belong, the rest in the compost pit for fertilizers." That was the comment that this nurse posted with this particular body. Her friends were a bit shocked with this and said, and started, commenting on, maybe you crossed some lines here. Her response to that was, "I can put up anything I want in my Facebook. It's mine, and people who doesn't want what I post, they can just go fucked up and die." That was her response. Now, in addition to her professionalism and her good judgment, it also certainly brings her grammar into play. Because that's exactly as it appeared in terms of the writing. So I looking at this and saying, wow, can you imagine if she applied for a position and an employer looked at this? Do you think she has any chance? Absolutely not. Interestingly enough, I did a little bit more digging into this, and there were a bunch of other pictures posted online. This is the same nurse. Right? Now that picture says a lot. Right? There's a lot of information in there. And again, this was posted online. It's still there. I mean, you can go in there now and look at this. This is a fairly tame picture compared to some of the other ones that were there. So it's her private life? Absolutely. But is it appropriate? That's the question that we struggle with. Right? And her thought, as she said in her comment, was, you know what? It's my business what I do on Facebook. It's not, you don't have anything to do with it. But is it? Is that public-private boundary that clear-cut? Right? And I don't think it is. So these are the things that we need to really think about, which a lot of people, in many cases, don't think about. This came, and it was another interesting quote that came from the Canadian Nurses Association, Ethics in Practice. As social media technologies evolve, their use will continue to present ethical challenges that nurses must consider. In all areas of practice, we need to think about the impact that these new technologies have on patient privacy and confidentiality, professional boundaries, there's that word again, and the reputations of individual nurses and the organizations they work for. So this comes from the Canadian Nurses Association. The quote that I started with from the Code of Ethics for Social Workers, there are a lot of similarities, right? There are a lot of similarities in those two quotes, but they say some very important things. And this, by the way, it's not just about nurses and social workers. I mean, this crosses all genres and all groups of individuals in society. And I do this presentation for different groups, and the same issues come up all the time. So you can see all these things that are happening. This was another one from a social worker in a magazine called Social Work Today, Matthew Robb. When social workers misuse these tools, social networking tools he's referring to, they can irreparably harm clients, sabotage their own careers, and cast a long shadow over our profession. Right? Again, extremely important. I've done a lot of sessions with kids in high school and junior high, and one of the big things that I try and impose on them is the effect that their activities today are having on their future, particularly with their employment, how it affects their employment opportunities in the future. The same thing happens with adults. When we do these things and you're advancing your career, not only do you have to face the embarrassment that some of these things can cause, but it can have a real effect on how your career may move forward or may not move forward. Thank you, and I'll now pass it back to Pam.
Thank you very much, Sandy. It certainly highlights a couple of things. Certainly the importance of our professional image and the knowledge that you have. Certainly an expert in that area. And as healthcare professionals, it is the expectation that if we are going to utilize social media, that we are aware of its uses and the risks, and certainly that we do manage those risks in our practice. So thank you again. And I'm going to move right along now and ask Tammy to speak.
While Siobhan's setting up, I'd also like to say thank you. I'm here to replace Molly Butler, so I can only hope I speak to the same level that Molly intended. I am using her presentation, so I may have to assist and use some notes that I've taken as well. So forgive me if I seem to be looking down a little bit. So as we go through, I'm just going to highlight some of the objectives for this session. We want to situate e-professionalism and social media discussion within an organizational and work context. I want to highlight some expectations of staff when using social media, both personally and professionally. I want to identify how Eastern Health is using social media and supports the use of social media. And I want to also suggest some strategies to maintain our e-professionalism. So just to kind of put it in context, if we look at all of the regional health authorities within the province of Newfoundland and Labrador, and I'll certainly highlight on Eastern Health region. So Eastern Health, as we all know, is the largest integrated health authority. We service a population of more than 300,000. We're responsible for a large number of unique programs provincially, including the cancer care and the public health laboratory. We have over, was estimated anywhere around 13,000 staff, including over 5,000 regulated health professionals, 630 physicians, and over 15,000 volunteers. We have thousands of students who come from Memorial University, College of North Atlantic, as well as other colleges and universities across the province and across the country. We also have some international students as well. So to put it in context, if you look at the numbers and the services we provide, it's clearly evident that there's a great opportunity for the use of social media to communicate both internally and externally. We have to be cognizant of the potential risks inherent when we communicate using the tools that are being used for social media. One of the strategic, my words are a little thick, sorry. One of the strategic directions of Eastern Health is quality and safety. Thus, having these conversations and through these learnings helps us build an improved quality and safety culture with respect to e-professionalism. Professional practice, I am a professional practice consultant with Eastern Health, but our department oversees the governance of 11 health health professional groups. We have a focus on promotion of good practice, prevention of poor practice, and intervening when there are practice concerns. If a breach of standards occur or has been identified, it can lead to an allegation to the regulatory body. Most of our work, though, however, I'm happy to say, we focus on the prevention and the promotion, so we don't have as much on intervening when things go wrong. Sessions such as today, as well as the ethics forum that was held on Friday, is an excellent example of how we work closely with our colleagues, regulatory bodies, universities, across the country, and certainly with Canadian Nurses Protective Society. I'm happy to say we've had Elaine Borg speak in our organization before, and we consult her on a regular basis, so we're very fortunate for the resources we have available to us. So other speakers have focused on e-professionalism. You will notice that there's often a lot of duplication, and I apologize because I'm also going to do that as well. So although e-professionalism may be a new term to many of you, professionalism is not. Regardless of the medium we use and whether communication takes place via social media, today in forms such as the conference room, any boardrooms, auditoriums, in an elevator, we have to remember that the basic principles and expectations for professional behavior still apply. So tomorrow, if there's a new way to communicate or new social media tools, the expectation is that we know how, when, and or if we can use them appropriately. Employer policies or guidelines should focus on professional behaviors rather than the medium being used. And currently within Eastern Health, some of you may shake your head and say we don't actually have a policy on social media. You're correct in saying that. There is a group coming together to look at the use of digital technology and social media. So they have met and they're looking at it from two sides, from both a technology branch as well as from a people or the people who use the service. So they're exploring that as well. But I think the biggest thing is that we look at is that we do have guidelines within the organization that have been circulated, and the expectation is that we follow these guidelines. And I'll be incorporating some of these as I go through. So as discussed previously, I show some of the social media sites. There are many more. Social media remains a virtual place to share socially opinions, information, experiences, images, videos, or audio clips, and it is used by millions of Canadians for social networking purposes. So it was really interesting. From Molly's literature, she said 1 in 3 Canadians use social media networking daily. And Net mentioned a little bit earlier that 82% of Canadians use social media. So from a net statistics, it certainly is a little bit higher. Based on Molly's literature that I'm referencing, I would have thought with over 13,000 employees, we have over 14,000 people on a daily basis using social media. But the thing that I find most interesting, if you break it down into the population we have within Eastern Health, and we look at the numbers, if we were to survey, I would venture a guess that we'd have higher numbers, purely based on the professional nature of our employees within the organization, the age of many of our employees, the clients we serve, as well as the students we serve, and basically because of the use of social media and our technology in the world that we use on a day-to-day basis. So I would venture a guess we're certainly up around 82%, if not even a little bit higher, just within our demographic as well. Eastern Health itself uses a number of social media tools, the internet, Twitter, Facebook, as well as they've just recently, within the last, I guess more than a year now, it's 2015, 2013, launched the Eastern Health Storyline, which was launched. And these tools are really important to the organization because they help to communicate with the general public, employees and other stakeholders, as well as to share information or expertise within the organization. And a prime example of that was last week, the Bridge the Gap app was launched. And this is meant to reach teens who are facing mental health concerns such as bullying, depression, mood disorders, etc., to kind of help cope on a daily basis. So not only are we using it to communicate, but certainly to share our expertise. So Eastern Health has created some resources and supports for staff. We have social media bulletins from professional practice. Eastern Health Human Resources Guidelines, as I mentioned previously, have been circulated to all employees in September 2014. Forums on ethics and social media in healthcare, which had taken place this past Friday. Professional practice consultants, I can speak for our group, both from nursing and all of the allied health disciplines. We include this topic in our orientation, so any staff from a regulated health professional group would go through our orientations. They would receive information on social media during the orientation process. We have newsletters from nursing and allied health disciplines that we have addressed social media in the past number of years. And we also have we're very fortunate in that we have a very strong resources or departments, human resources within Eastern Health. So we actually have the Human Resources Department. We have a very strong professional practice department, representative of nursing and all of the allied health disciplines. We have a privacy department. We have quality and risk. We have a very effective ethics department as well. And we're also fortunate enough that we can consult our legal counsel on a regular basis, our in-house counsel. And I mentioned the committee that was recently struck to look at the policies as well. So even though we may not have an existing policy, we're in the process of developing it. The policy on social, wasn't so much social media, it was the use of cellular devices, was focused on the safety aspect. So we know now that is outdated and antiquated, so we're looking to move forward with the social media network. And again, that will focus with two lenses, with the technology and the people or the human resources component. So in thinking about what's expected of health professionals when using social media, I've kind of got some questions. I won't go through the slides. I'll leave that for you to read through and reflect on when I'm speaking. And I guess, as Annette and Sandy have also mentioned, you want to think about your personal profile. It certainly can have an impact on your professional profile as well. So the question I have is, do you know what your personal profile says about you? Major issue is privacy or lack thereof, and I think we've all heard from the past Friday, and certainly if you've done any work on social media or e-professionalism, that social media is a public domain. It's meant for sharing information. It's not, the focus of it is not for privacy. So we need to be cognizant of that when we think about what we post. And I guess the other thing is, even if you think you're not on Facebook or another form of social media, you could be tagged by someone else. I'm very fortunate. I have a Facebook page. I have 41 friends by choice, but I know that I'm often tagged in somebody else's pictures or profiles or comments. So even though I may not have sanctioned those, I know they exist. So it's something for us to think about. It's also important to remember that your codes of ethics, your conduct, your standards of practice are the same online or as in any other circumstance, as I mentioned earlier. We need to read and understand our privacy settings and note that these do change on a regular basis, so we need to keep abreast of the changes in our technology that we're using. We must never assume that any information posted will be kept private. It does have the potential to go viral, as others have said. Even if it is set within your selection of friends on your your social media sites, it can certainly go beyond that. And it's also really important that we remember at the end of the day our clients. We never want to violate our clients' privacy. And I'm sure some of you may have the question or been faced, do you friend a client on Facebook? And you have to be very cognizant it can cross your professional boundaries. From an organizational perspective, we want to remember that each employee, officially or unofficially, is representative of the organization. So be very cautious of what you say on your social media sites in relation to your employment status, your experiences while you're working, or to regards to your employer or your coworkers. Posting from Eastern Health could be interpreted as being endorsed by the organization. So if you have on your social media network site your status that you're an employee of Eastern Health, what your professional designation is, and what your role is, then you certainly need to be cognizant of that. Improper posts can result in violation of professionalism, and remember your professional standards to apply. The other thing to remember as well, all your postings do stay out there. They leave a digital footprint, so they cannot, even if we remove them, they still exist. The other thing we want to think about is a productivity. So if you use social media sites or networking while you're at work, it has the risk for decreased productivity. The organization clearly has a stance that whatever communication you do on your social media sites should be done on your periods of rest or your meal breaks, because we want to make sure that it doesn't impact the care we deliver and cause any delays in care. Sorry, speaking beyond my slides. Also as well, we got to remember that a lot of the issues with social media occurs not while we're in the workplace, but certainly when we're outside of the workplace. We want to make sure that your reputation is not blurred, you haven't crossed any professional boundaries. It's really important not to place or to deal with workplace issues on your social media sites, so don't put any defamatory or derogatory comments on your social media site. We're all accountable for our actions, and as a regulated member of a regulated health professional, we have to remember that our responsibility is to regulate our own individual practice. The other things, sorry, just a couple more things to say. I know my time is up. Social media technologies are here to stay, so we need to be cognizant of that. They are pervasive, so we need to build up on our knowledge and our social media technologies and related resources. We need to understand our organization's guidelines and policies when they exist, and we also have to take advantage of our professional resources, whether they're associations or our own expertise within our own organizations. We have to respect our clients' privacy. We have to be aware of any potential confidentiality breaches, not only to be aware, but if we have the knowledge of them, then we have to quickly report those to the organization as well. And the most important thing, the last thing I will say, is before communicating on social media, we need to consider what is being said, who might read it, and the impact it may have if viewed by the employer, a friend, a client, or a regulatory body. Thank you.
Okay, thank you, Tammy, certainly for highlighting many of the resources that are available for healthcare professionals, and for highlighting, a lot of the valuable work that Eastern Health is doing to assist its employees as they practice in that digital age. Thank you for highlighting also the expectations of healthcare professionals as it relates to social media, and as well some of the strategies that we can utilize and employ in our practice. So I will now go ahead and introduce our last panel member, Elaine Borg, and ask Elaine to come forward. Thank you.
So I'm not checking Twitter as I'm up here. This is my clock. In fact, none of the lawyers at my office have a Facebook account. Why would that be? Stakes are too high, don't want to get it wrong. So I have the fortunate position of being last. So a lot of the good advice has already preceded my talk, but so I'll carry on and just tell you what I have to say about this. So as you know, lawyers can be very wordy. We used to get paid by the word, and we still, even though that's not really the case anymore, talk a lot. So I came across this quote, and it's meant to be about lawyers. You're basically saying, what is professionalism? Are lawyers even professionals? So I better read this quickly. And of course, I was preparing for this talk at the same time, and I thought, well, this is a good reminder as to this ancient social contract that all professionals have had, as they are a subset of society. And they say, well, we will educate ourselves and regulate ourselves in the public interest in a certain way, but it comes with responsibilities. So confidentiality, it's in the Hippocratic Oath, so it's been around for thousands of years. It's not a new idea. But notice how we talk about here about society's well-being, in which all citizens have a stake. I think we'll get into these ideas more as we deal with the two case scenarios that are coming up. But this notion that we are given certain standing and privileges because of our professional position, but it comes as a part of a deal. So there's certain things we are to do and not to do. So social media, is there a place for social media in the practice of nursing? I think my best answer to this was something I read about a year ago where, because it's been around enough, Facebook's been around for, 7, 8 years, something like that. It's been around enough for us to actually cogitate about this and watch all the problems and say, really, Facebook and Twitter, when you have a corporation around you, really is about getting out a message. Public health might use it to talk about flu clinics or all kinds of different things, but the message is going out as an organization, and so all the PR people and the legal people might screen it for the messaging and so on. It's more problematic when the individual starts to use it. And you've seen the examples, the quite lurid examples. None from Switzerland. I'm half Swiss. There would be no Swiss nurses acting like that, would there? So it's easy to talk about the benefits, and of course none of us here would revile the benefits. But it's the risks, and of course, I am the fourth speaker, so a lot of the risks have been identified. The scope of distribution, permanence of education, of information, the misapprehension around privacy controls, these have evolved with time. I often use an example from Ontario where she wasn't a regulated healthcare professional, but a care provider in long-term care, was having the very disappointing experience whereby her facility, her employer, was building a second site, because we all know we need more long-term care capacity. And so she wasn't going to be able to work with her colleagues anymore. Didn't like this at all. So she created what she thought was a private site so that her buddies could log on and they could have the kind of conversation they would always have at coffee break and lunch breaks and so on. Well, it was full of derogatory comments about the employer. It was full of photos of residents with identifying information, none of whom had agreed to have their photo taken or would understand what a blog is. And so the sister-in-law of the manager kind of poked her relative one day and said, "You know what's going on online about your unit?" No. So of course they go online and they see all of this, and so they bring the person in, and she denies it. So they show it to her. This is one of those games you get to play when you're disciplining somebody about this. No, you can prove it really quickly. You can cache things. So what we're seeing is that people don't necessarily understand the privacy controls, and at the same time, the big organizations who profit from this change their privacy settings because this is how they're going to gain money, is they're going to have to sell their lists and, you know, advertising and all this kind of jazz. People are still trying to figure out how to make money off the internet. So Facebook has become more and more open with the fact that really you're not going to control much of anything if you post things on their site. The other corollary to that we've seen in the legal literature with time is, and I think it's a reflection of who was starting this industry 10, 15 years ago or more, they thought that they would just ignore summonses to court. They would ignore a court order to hand over the information the internet service provider had about who the user was. So hence this business of pseudonyms. Anonymity, of course, is not guaranteed. In the early days, Google, etc., thought that they could just ignore the usual operation of the law, which of course they've lost on many times, and they don't resist production orders anymore. A reputation damage. So you're the professional. So in the relationship with your patient or your client, you are the one with professional responsibilities, they are not. So this is about your reputation, your job, your license, not theirs. So who should be in control of your own image? Should it be you or should it be them? Do they understand what's at stake? They might. They might do this deliberately to you. So are you setting your own self up for failure? So you want to be very careful about what you allow to be said or done about yourself. So here's our latest example in Canada. We have an uncertain outcome for multiple fourth-year dental students. So again, people who've invested in their careers. The boys will be boys comments I utterly reject. When you're in the fourth year of your professional program, there are no boys and there are no girls. So these are adults and they've made choices and they may bear the repercussions of those choices. We have nurses doing this kind of thing at work. So at work, what are you supposed to be doing at work? And next time the contract negotiations come up with your union and your employer might be thinking of all the time they have to spend undoing this kind of mess. So when nurses say they're so busy, they don't have time, they don't have the time they want to spend with their patients. You hear that all the time. They don't have the time to do this, they don't have the time to do that, and they're so overworked and underpaid, they want more time and money. Well, the more time managers and administrators spend with this kind of thing, the less that argument about time and money is going to resonate with them. So what did CARNA do? CARNA is the regulatory body equivalent to ARNNL in Alberta. So what it did in late 2011 was it adopted wholesale, with some really bad grammar that I fixed for this purpose, some of which I kept just to illustrate it. They adopted what the whole US of A, Nursing Council, wrote. And I find it's very embarrassing reading, to be frank. Don't transmit patient-related information. Well, who needs to be told that? I mean, we all were taught confidentiality on day one. None of us should be needing a reminder of this. And yet here it is for the whole US of A that Karna decided as they're getting ready for Christmas that year, they'd better put on their own mind because they were having to deal with nurses doing these kinds of activities. And ARNNL has chosen to spend some time and energy on it as well. And I can go across the country, because that is our scope, and show what licensing bodies are having to deal with, and the message is the same over and over again. And again, a point I want to make is it's not just nurses, I'm sure it's not just social workers, but it's dental students, it's pharmacists. These are intelligent people who've spent a lot of time and energy passing a lot of hurdles, spending a lot of money. They're going to have a long career in the public interest, and look what happens. A dispute at church, I think a romantic dispute, bunch of women fighting over a man, and so a little bit of a tussle takes place. And then the pharmacist must have said something to herself like, oh, you didn't like that? Watch this. So my question, when I go through these and I read many examples of these, I think, what were you thinking? I don't have a spare $30,000, and I won't want my regulatory bodies to say, don't worry, Lane. I will let all the other regulatory bodies in Canada know what you've done, so that if you want to move within Canada to practice your profession, they'll know what your history is. And we have another example later about a pharmacist using the patient's health record to try and arrange a date with her. Now, privacy of personal health information in that way is not our subject for today, and yet I see a lot of this kind of problem as well. The blurring of the professional life and the personal life. There's something about human beings, we love these shiny little objects. I'm like that myself. I log on, the circle goes around twice. Uh-oh, better call IT. Well, it's been about a nanosecond. So it's like this stuff can't go fast enough for us. But all of us here would say, put the brakes on. What are you doing? You've got to think about this. Do not let your fingers do the talking. Think about it. And then another take on it that I've seen in my personal or my professional life, see, I just did it, as a nurse, is situations will arise that are unique. You've never heard of this before, and that there you are at work. Say, for example, you're the nurse in charge, and suddenly you have this mess to deal with you've never dreamt of before. So in this situation, no nurses appear in the actual scenario, and yet, having been the nurse in charge and having been brought in to deal with things that the cleaners are doing or wanting to do, that the guy from the boiler room wants to do, you get pulled into all kinds of things, and you are seen as a leader even if you don't have that official title. So in this case, we had a janitorial staff who were brought in to clean up a site. A teenager had been hospitalized and successfully committed suicide by throwing himself off the hospital building. So they dealt with that emergency, and then these people were brought in to make the site right. So instead of doing that, one of them decided the right thing to do was to take photographs with his cell phone and then post them online. So he was terminated. Grieved that, and the result of the grievance is, as you see. The answer must have been, you must be kidding. But what I think that you should prepare yourself for as nurses is that you may witness people acting in a way with their digital technology that must be stopped. And so you must be familiar enough with your professional standards and exemplify them as you work, such that you have the moral authority to step in and stop this and make sure the right thing is done. So what if there's no social media policy at work? I've had this said to me in almost that kind of, ha, 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 there isn't one, so I can do what I want. And it's a very strange kind of view, because as a professional, this is, I go back to my first slide, You are hired as this bundle of standards and ethics. There isn't a profession, name it, architects, engineers, lawyers, all the rest of them, all have some form of code of ethics. When you enter the profession, all of them have some kind of screening for good character. So there doesn't have to be a policy in order for you to be brought to bear by your activities, most especially at work, but we're grappling with this business of what does it mean in your private life when you have crossed the boundaries. My worry is that the penalties will get higher and higher because we're seeing this kind of bad behavior with little self-control being exercised for no really good reason. So I personally don't need any more examples about what's going on in Canada about e-professionalism and the breaches of that, and I'm sure that the panelists are the same. So I just listed for you some resources. CMPS has written about several of these subjects. There are resources that you'll have through your employer, through your regulatory body. There will be privacy officers with your employer, with the province, and then you'll have other professional resources as well. Because you will inevitably deal with dilemmas. This is new technology. It's only been around for a few years. We love it in our private lives, and we still haven't come to grips with it. So stay in touch. If you have questions, before you push send, you could maybe pick up the phone and call your resources first.
Thanks, Elaine, and thank you to each of the panelists, because from all your varying perspectives, there's this thread of common messages that are coming through. And so now it's time to take all that information and apply it to a case example, which is what we're going to do at this particular point. And we've got two case examples, as Pam said earlier, that we're going to share with you and get our panelists to weigh in on it. So the first one I will read out, as Siobhan puts it on the screen. The first one is a healthcare professional named Paula, and recently she decided to join Facebook so that she could keep in touch with her family. On her Facebook profile, Paula listed her employer and area of work. Hearing that many of her colleagues were also on Facebook, she added several of them as friends. So one of her colleagues noted that Paula liked a Facebook page that contained derogatory comments about people living in poverty. Her colleague was very upset and wondered what she should do. So we're just going to get each of the panelists to talk about the legal, ethical, and professional considerations. If you'd like to add in a little twist there, feel free to bring in some other elements. And I think for the first case, we're going to start off with our first speaker, Annette.
This is certainly an interesting case scenario that speaks to the interconnectivity between the personal, the professional, and the public, and how something seemingly so routine and innocent can spiral potentially into something greater and have professional implications. So I want to start off by saying that certainly Paula has a right to her personal opinions. The challenge is when one's personal opinions conflict or are perceived to be in conflict with one's professional values and ethics in the public domain. So as I noted earlier, as professionals, we are guided by a code of ethics and standards of practice, and we signed on to those values and principles when we chose our careers. And so we don't stop being a professional at the end of our workday. So Facebook is a very public forum, and while it's recommended that we set our privacy settings to the highest level, as noted earlier, this does not guarantee that our comments or our postings are private. Everything is recoverable and can be shared instantly and can be misinterpreted and harmful to our professional reputations. How many of us who use social media have seen something inappropriate that was posted online, or were embarrassed by something that a family member or friend posted? So I would suggest that professionals not post anything online that they wouldn't want an employer, client, or colleague to read. And that includes the liking of Facebook pages or events, posting links that contain discriminatory, profane, or inappropriate content, or joining causes on a social media site that may not be in keeping with the values and ethics of our professions. So when I looked at this particular case, I immediately thought of, issues pertaining to boundaries and self-disclosure. And we know that there are many types of self-disclosure: planned, accidental, and unavoidable. So while it's not certain that Paula intended to like this Facebook page and agree with the messages being portrayed, I would consider it a form of self-disclosure. So some questions that I would encourage Paula to consider would be, well, is this self-disclosure accidental or was it planned? Did she have a clear understanding of the nature of the site and its content before liking it? Does it give an accurate portrayal of her beliefs and opinions? And how might this action impact on her professional reputation? How she might be viewed by colleagues, clients, her employer, or even the community at large. And so while Paula's colleague is clearly upset by her action, it wouldn't be preferable for him to address that through Facebook. To question or post a comment through Facebook, which again is a public forum, may bring unwanted attention to the issue, to what might be an isolated incident, and add more fuel to the fire. It's simply not a professional venue for addressing concerns with colleagues. So depending on how close the colleague is with Paula, he might decide to have a private conversation with her, and he might also find it helpful to consult with a peer or colleague. And your professional body might have some resources that might be helpful as well. For example, the NLASW does have a guiding framework document for social workers concerned about the professional practice of a colleague. If Paula's liking of the Facebook page was not intended, Paula would need to consider how to address this issue. Simply unliking the page may be suffice. Again, the intent would not be to bring unnecessary attention or focus to the issue. If it was different and she actually made a comment about people living in poverty that was posted to a blog or another social media site, it may not be as easy as simply deleting it, because as we've heard, by the time you delete it, you have no idea how many people may have read it, posted it somewhere else, forwarded it on to a friend, and it's gone viral. So I want to just take a moment to look at it from a different angle. And what if it was a client who saw this on the social networking site? What might be the impact on the therapeutic relationship? What if it was a client who experienced poverty and read the post? Could this impact on the client's trust and confidence in the professional, and not only in Paula herself, but in the profession that she's representing? So these are questions that would certainly be helpful for her to consider. It sounds like from reading the Facebook page that Paula, it was a personal Facebook page. So I questioned, how did the client come upon this information? Did the health professional have the privacy settings set to the highest level? Did she have friends as clients, as her friends on the social networking site? So those are all things that she would need to think about. As users of social media, the onus is on us as professionals to ensure that we promote information that's in keeping with the values and ethics of our professions, and to be cautious in endorsing, liking, retweeting information that we have limited information on. And pause before posting is certainly a great risk management strategy.
Thank you. I'm going to pass it to Sandy for
Thanks, Annette. That
comment.
actually was really a really good synopsis of this case study. So I'll just add a few comments. There are a number of things that are going on here. That's, on its face, it seems like a very straightforward, simple scenario. But I think when you drill down, there are a lot of other things there that need to be considered. The first thing that you notice here is that Paula is new to Facebook. Okay, so this is something that's relatively new to her. So there's probably a really good opportunity here to deal with this before it can spiral out of control. And as Annette mentioned, this may be a good opportunity for that colleague to have a personal conversation with Paula and say, look, this is really not appropriate. And, in many cases, Paula or someone like Paula would say, I never thought about that as a new user of social networking. So, again, we can use that as a positive experience. The other thing here is that the first thing that Paula does is accept colleagues as her friends on Facebook. When you do that, I believe you've automatically now connected your private life with your professional life, because it's one thing to have your friends and dealing with your friends, but when you have your colleagues, your co-workers there, then what's done is automatically reflected in your profession and in your career. There's a really good example of this that I often use, where an individual, a young, early 20s, gentleman, he was an intern at a bank, and he went to his boss and said he had a family emergency and he needed a day off. The day that he was looking for was the 1st of November, which happens to be the day after Halloween. And what he actually did was he went to a Halloween party the night before. He just wanted the day off to recover from his hangover. And there were a number of pictures that were being taken. The costume that he had on was actually a tutu. He was dressed as a fairy with a little wand and a tutu. And there was a picture posted of him with a beer in his hand, dressed in this costume, and was supposedly away dealing with a family emergency. Well, a bunch of his friends were his coworkers. So what do you think his coworkers did? Right? They printed a copy of that picture and they laid it on the boss's desk. Right? So they weren't really friends, but they were coworkers, and that ended up getting him in quite a bit of trouble. And it's now online for the world to see for every future employer that he ever imagines. So again, it's very important that when you have your colleagues on as connections or friends on Facebook and social networking sites, the line becomes very blurred. The other thing as well is Paula listed her employer and her area of work, so that's there for everyone to see. So all of the colleagues that she has as friends are all working in that same area. And the other thing as well is that what Paula did here, she didn't post anything, she simply liked a Facebook page. But that Facebook page was very telling. And as Annette had said, that's really a disclosure of the type of person that Paula is. Now, whether she did it on purpose or not really becomes irrelevant once it's online, because she can claim that it was accidental, but it might be a case of the damage has already been done. So, and I mentioned earlier about the number of likes. I think it was 4-point-something billion likes per day. So people are doing this all the time. Just because my friends liked it, I'll like it as well. And that can very quickly get out of control. And I really do believe that many people will like certain things without really understanding what they've done. And that's where we really have to sit back and think about some of the activity that we're involved in online. Thank you.
Great comment. Tammy.
Much of the things that I thought about were already addressed, so I won't go through them again, but I will just say if this concern was brought forward to an organizational perspective, so I'll just take it from that lens. So I guess the most important thing was if it has an impact on her personal her professional life, it would probably go through the organization. So as a professional practice consultant, we would be contacted. We could certainly meet with Paula and her manager, discuss the complaint, and explore with Paula the importance of e-professionalism as well as her understanding of social media. So like Sandy mentioned, she may not understand exactly what the like meant or to understand what she had liked. Annette also mentioned that as well. And some of the literature that I quickly read had indicated that just by liking something, I guess it's like anything, it doesn't excuse what you've liked. So it's the understanding that if you liked it, it's almost as if you're saying it yourself. So you have to be very cognizant of that as well. We would speak to her about the potential harm, if such harm existed, and cause her that could cause her damage to her professional image, her profession, and her organization, and the potential for blurring her personal and professional persona or image. And as an organization, we also have to look at public trust. So we have to make sure that her portrayal, how it reflects on the organization as well, would something that we would certainly consider. Remind Paula, while she does have a right to her private opinion, when we become a health professional, we take on the responsibilities of that role, and that's been clearly articulated up to this point. They may actually come out into the public domain. We would also help Paula to become knowledgeable. We meant to be supportive, not necessarily punitive, but we'd certainly take a supportive role with Paula to become more knowledgeable at the use of social media and the consequences of liking that type of page or any type of page that it's against our organizational philosophy. We might also recommend education for Paula around the appropriate use of social media, either by webinars, additional education, or additional training. We might also examine the issues emerging from this case as a department and decide on education more globally across the whole organization, because these are not specific to one practice, one discipline. So we may do global education either through a bulletin, policies, orientation, and we'd encourage our colleagues to participate in forums such as this one or the webinar that occurred on Friday. And again, just make sure we have a global message sent across our organization. Thank you.
Elaine.
Yeah, I would agree that she's chosen to mix her personal and professional life. If you look at her rationale for having a Facebook page, it was to connect with the people in her personal life. So once you've identified yourself as a professional person, it would be very difficult to say that you don't have those standards to live up to. Doesn't mean that you become everybody's nurse, but it does beg the question. The other thing that came through my mind as I looked at this for the first time was she liked this page, but why did she like it? Did she even read down to where somebody made derogatory comments? Because, I read little online about other people's personal opinion because it's a really poor reflection on the human mind when you read the dross that's online. So if she were looking at something because she read the site and what their mission was and what they were doing, but then somebody else has written about, all those scumbags are eating my tax dollar and blah, 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 how could she be held to that person's comment? So I look at this and I say, well, what was that site? Because she could be utterly innocent and simply wanting to support something that was doing work that was in line with her professional goals and so on. So for me, there's not enough information here for me to frown upon her. But it starts to beg the question. Just how closely connected you want to be with things that are online. And as I said before, slow down. Don't quickly click on things when you have identified yourself as a professional person. There are many people who've rued the day and are left having to explain, like our Dalhousie student who basically all over the Globe and Mail was saying, hey, wait a second, I'm one of the good guys, I was the whistleblower. And you didn't hear from him anymore once a statement was made that, well, you had liked that posting about the sexual assault of your colleague. So he was no longer all over the Globe and Mail all of a sudden. So really difficult territory, and you can get yourself in trouble in such a short space of time and be left trying to account for your behavior, and that's where all of this risk management is coming from your regulatory body, from your employers. They don't want to spend your time and money and their time and money investigating these kinds of things. There are bigger and better things for us to spend our time on, and yet they're caught. We're all caught having to do this. So I would just urge people to slow down. If you think you don't have time for that, I can reassure you strenuously that if the legal proceedings are underway, you will have no choice but to spend the time and the money. So it is worth the investment of being very clear about what you're doing online.
Thank you. All really good points, and I think we'll move right into case number 2. And Pam.
Okay, Martin is a healthcare professional. He works in a mental health setting with clients with addictions. Recently, he shared a post stating how wonderful his work with a client was going. He noted how proud he was of the client, and he wished his other clients were as dedicated as this client. He noted that the client had 3 children and a wife who was a teacher who would now be able to return to work on Monday. Another client of Martin sees this post and is quite upset. He calls Martin's supervisor to discuss. So I'll ask Elaine to comment first on this case.
Martin, what were you thinking? So, what is this post? Is it your own blog? I don't know. It really is using information about his personal life and information not about within his control for some kind of public exposure. So the duty of confidentiality we all have with our patients resides with the patient to release us from, and unless they've released it, we hang on to it and are never to breach it short of a court order, for example. So in looking at this, we've got somebody who's comparing and contrasting his patients. And if he works in addictions, I'm sure he knows that dedication is not what overcomes addictions. There's more to it than that. So I wish Martin hadn't done this. I wish if he needed to express himself about his work, could find another way. There was a book that was published, I think around the year 2000, called From Silence to Voice, and it was written by 2 American journalists about nursing. And it's a wonderful book. I don't know if it's been updated to include the Twitterverse, but their view is, and I agree with it, is there's a way to bring forward to the public forum the work that you do as a professional, but you do it in a particular way. And you use anonymized data, you can use case studies that are, of a certain type rather than individual information, unless you have somebody who wants to champion a cause as a patient and they become a spokesperson too. So you have to be really careful about what you do, and there's maybe inadvertence here. There may be, again, maybe acting too quickly and not thinking it through, but I would say that if you want to talk about your profession in the public space, seek advice and research it first to find a way to do it such that it won't impact you here. Again, the professional is the one with professional standards brought to bear all the time in relationship to the client, not the other way around. Identifying personal information is not just somebody's name. It can be had by data around that, not just a name. And my last word, I wanted to say this in my presentation, I didn't, especially in regards to Facebook. The language used is very telling. So do you friend somebody? The clue is in the word. You can be friendly with your patients and not their friend. That's what was told to me by my first year nursing prof. That was a long time ago. That was over 30 years ago, and it remains even truer today. So be as friendly as you want, but you're the one who has to know how to set the boundary and then keep to it.
Thank you, Elaine. Tammy?
Just to kind of build on that as well, from an organizational perspective, I would take it from the lens that if confidentiality breach had occurred, then we would go through due process to ensure due diligence for the individual. For Martin, has certainly occurred to make sure that it was a valid breach, or that there was enough evidence here to substantiate a breach. We would work through our internal process, and if it was identified as a breach, then as a regulated health professional, we have a duty to bring that forward as an allegation that there was a breach of standards. So we would go to the regulatory body if that was the case. The other thing that, just to remind everyone, that all of your policies within the organization also, regardless, as I mentioned earlier, regardless the form of which you had the conversations or you discuss patient information, they still stand. So even if it is on a social media site, then we're still held to the standard that it could be a confidentiality breach. The other interesting thing that I thought when I read this was the second patient. So the first person, Martin, we'd worked through the process whether or not he actually did have confidentiality breach. Was the second, another client of Martin sees the post and is quite upset. So we have to make sure that we instill and we maintain our public trust for the other clients that are also involved. So not only was it with the first client, but there also could be damage for the second client as well, or any subsequent client that could be connected. So in that case, we have to ensure that our organization maintains that public trust, as we all know that it is foundational to any therapeutic relationship to make sure that we maintain that level of trust. So we would have to set programs and supports in place, not only for the clients whose information was breached, but also for any subsequent clients that may be involved in Martin's care as well. So we would work through our own professional disciplines within our organization and set that up. So I thought that was something that's really interesting. So what we would learn globally, again, we would take the information and any learnings we have, we want to make sure we take it on a case basis and we move forward so we get additional learnings from it. So we would look to see if we could somehow take this as a learning opportunity within the organization to share this information, certainly redact it to remove and make sure there's no identifiers for the individual healthcare professionals involved, but to take it as a learning opportunity and share, whether it be through individual educations within a certain area or globally through webinars, bulletins, that sort of stuff. And I guess from my own personal perspective, what I always say to everybody is think what you'd like to read, the same information on the front page of the newspaper. So if somebody writes any information or the information you disclosed, and Annette certainly mentioned this earlier, we have to defend, if in the event that we're called to defend our statements or actions, are we okay to see it on the front page of the newspaper for everyone to see?
Thank you, Tammy. Sandy?
Thank you. In the privacy world, we often talk about sensitivity of personal information. So a person's phone number, for example, is their personal information, but probably is available in the phone book. So it's not as sensitive as some other information. At the opposite end of the spectrum is really your personal health information. That is probably the most sensitive, private, and personal information that we have. So, you know, in both of these cases, certainly this one, we were dealing with very sensitive information, addictions, for example. So the irony here is that Martin probably felt he was doing a positive thing because he was talking about how wonderful an experience he was having with the client. I mean, that may be so, but he certainly did show poor judgment. So he may have been trying to be positive, but in comparing to other clients, you know, there was certainly some poor judgment in a very sensitive environment. The other thing that we talk about in the privacy field is personal information is information about an identifiable individual, right? That doesn't necessarily mean their name, and Elaine alluded to this as well. The information that Martin provided about the client is at a fairly significant level that that person is probably identifiable. There are a lot of people out there that would know who this is without seeing their name. So again, you know, that's a concept that a lot of people struggle with. They think, well, if I didn't provide the name, then, you know, I haven't breached anybody's confidence or personal information. When in actual fact, it's very easy to do, particularly in Newfoundland. We're in a very small jurisdiction, small environment. You know, a lot of people know each other. You're talking about small communities. You know, if you're in a community with 150 people and you're describing someone within that community, it's probably very easy for others to identify who those people are. So, you know, it's a very important concept to bear in mind. And again, I think in Martin's poor judgment, not realizing really that that he may have breached confidentiality and privacy of individuals he was involved with. Thank you.
Yes, certainly I thought this was also a very interesting scenario, and one that might not be as uncommon as we think. Given the fact that we're all social beings, there's a tendency for us to want to share our work successes and, you know, things that we do really well in our jobs. And I guess when I looked at this case, it came back to the whole issue of personal versus professional boundary. And I thought it raised some very interesting questions. I just want to go through some of those. So certainly, was this something that Martin posted on a personal or professional social networking site? And I don't think it really matters because a client still accessed it. So it was still client information that was posted. And of course, that will have professional implications for Martin as well. We've already talked about in terms of the impact on client confidentiality and privacy, and Sandy, you alluded to, you know, in terms of that information being very identifiable. And as professionals, it's our ethical responsibility to protect client confidentiality and privacy. And how might Martin's client react if he saw the post? So another client brought the issue to the attention, but what if the client saw that? The client's wife, his children. And so I don't think, when I looked at the case, I don't think it was intentional that Martin wanted to pose any harm in his effort to speak about the client's success. But he did breach client confidentiality, which I believe, and it's quite serious. And the impact on the client and his family may be more harmful than certainly what Martin had intended. So it would be important for Martin to consider whose needs were being met and for whose benefit did he decide to share that information. Was it for the client's benefit, or was it to, you know, tout his own professional accomplishments in working with this particular client? So it would certainly be in the client's right to bring this to the attention of Martin's employer, the respective regulatory body, and also could be an issue under the Personal Health Information Act. I also thought about the question in terms of how might Martin's colleagues react to this post. And as we know, social networking is meant to share information and invoke social dialogue. So would it be appropriate for Martin's colleagues to respond to this post favorably or unfavorably? And how might Martin contain the discussion once it goes viral? So someone likes, you know, we were talking about that earlier, someone likes the post, or way to go, Martin. So how might that be viewed by the other professionals? And so literally, with one click of a finger, Martin's reputation, along with other professionals, may be tarnished. We know that another of Martin's clients saw the post and brought it to the attention of the supervisor. So we also need to consider how this client and other clients will perceive Martin's level of professionalism. Do they have a right to be concerned about their privacy and confidentiality? And how might they internalize the post? They might wonder, well, I'm not doing so great. Why is that? Why is he so proud of this client, but he's not proud of me? And that could impact on the relationship. So Martin needs to reflect on his level of professional disclosure that's appropriate for social networking sites, and it might be important discussion as well in a supervisory session. As healthcare professionals, we can seek guidance from our code of ethics and standards of practice. And of course, ANRNL has documents that's available, as well as the NLASW. I want to take a minute, though, to consider this scenario from a different situation. And what if it was Martin who was posting his frustrations with his lack of progress with a client? Would you see this as being more or less serious than the current scenario? Professionally, I believe the same ethical principles would apply: privacy and confidentiality, clients' expectations and rights, blending of personal and professional boundaries, informed consent, professionalism. The internet is never a good forum for posting frustrations or anything related to work on a personal site. And what if the situation didn't involve a colleague but a student? And I think I just want to leave you with that message in terms of our ethical responsibility to educate students who we may be mentoring as instructors, as mentors, and how do we, encourage that dialogue so that students who are entering into our professions understand and are able to apply the ethical framework that's needed to these, very subtle sometimes things that we need to be addressing. So I just wanted to mention that as well.
Thank you, Annette. So we are now going to move right along, and we have some time, a short time, probably 5 minutes for some questions. So I will take an in-house question first, and when you are doing your, asking your question, we're going to ask you to speak into the mic that will be provided for you. So you can just raise your hand if you do have a question, and our Vannas will come down. Any in-house questions? Okay, we have one question right down here in front. I'll ask Karen to bring the mic down. And if you could introduce yourself and then ask what speaker you'd like to respond, if possible.
Trudy Button, and I'll put this out there to anyone who wishes to respond. There's been a lot of discussion about the impact on the organization and the impact on the client and the individuals. I'm just going to flip it on its end a little bit and ask for commentary with respect to the impact on the professional who's actually done this, because having been in a circumstance where I've had the misfortune, I guess, over the years to be involved with professionals who have been subject to disciplinary proceedings, I can say to you that it is not an easy job to watch another professional go through a discipline process, which, if there's a serious violation, could result. So I'm just thinking if someone would like to reflect on the impact that this type of process could potentially have on the individual professional as opposed to the organization or the client.
Sure, I can certainly start with a couple of comments there, and Elaine may want to clarify a few things. The legal community has been struggling with this in terms of disciplinary procedures, but it's starting to happen a lot more now. There have been, in terms of personal ramifications, I mean, here in Newfoundland, we've seen individuals lose their career, lose their jobs, and been charged and fined. Some of the fines are fairly significant. So if you're involved in these types of things and end up both losing your job and end up with a $10,000 fine, it's a very real impact on you as an individual. But I think we're going to see more and more of this. There have been a number of cases where individuals have been disciplined. There are a number of arbitration cases now, or decisions, and I think there's been some case law that's starting to build on this. And in certain cases, terminations are being upheld. Sometimes they're not. It really depends. But you're certainly inviting quite a significant impact on your career.
Thank you, Sandy.
I would echo that, and I look back to the slide I offered you about the pharmacists, and this is what we're seeing, and my hesitation about my concern of healthcare professionals engaging in this kind of behavior is they seem to be blithely turning a blind eye to the fact that it could all end for them. So what we're seeing is immediate termination, which will be grieved and upheld, the termination being upheld, so you've lost your job. So by law in most provinces, this is required to be reported to your licensing body that will then investigate around standards and ethics. And it could be referred to the Privacy Commissioner. It'll depend on the Personal Health Information Act in each jurisdiction. They're structured a bit differently, but you may be in front of a court because it's a provincial offense to have breached privacy if that is actually what's gone on. So in the pharmacy example I gave you, which is the clearest one I have others that are a bit of a jumble, or else they haven't reached that stage yet. They haven't just matured to that outcome yet. This person was fined $15,000 by the Privacy Commissioner, fined by their licensing body, ordered to pay the hearing costs of their licensing body because it was deemed that there was no need to really have held this hearing. So they looked at their own internal processes because they're not required to ask that costs be ordered. And so the impact of this can be so huge when I look at the time commitment and the energy commitment to actually make those postings and to have breached privacy by going into the electronic health record for the province that this pharmacist accessed. The time commitment to do that was probably seconds and minutes, and then you've just lost years out of your career. There's no proportionality here, and because there's no excuse. This is all about your own choice. It is nothing like a patient alleging negligence, where there's going to be a real scrutiny of all the evidence as to whether there's a breach in the standard of care that caused foreseeable harm, and on the other side, the defendants are saying, well, yes, I acted reasonably and carefully in the circumstances. That can take a lot of back and forth and investigating, and the outcome being different from what people thought it was at the beginning. With this stuff, it's not that difficult to decide whether a healthcare professional should have posted a picture of themselves beside a dead body. It starts to, for my mind, make me think of things in the criminal code like perpetrating an indignity to a dead body. This lands you in jail. I find it incredible what people are willing to do because this was invented a few months ago. It's really astonishing what people are willing to do, and it's hard to summon a lot of sympathy. I was at a panel like this a couple of years ago in Saskatchewan, and beside me was the provincial union, and it wasn't going well in the room. There was a lot of resistance in the room to our same messages here, which I found really interesting. It's the only time I presented where there was discontent coming from the crowd. And one person challenged me about what I was saying. She wanted to interpret my words as saying we shouldn't use technology in healthcare. And I almost laughed out loud. I said, there's nothing I've said about that at all. I've said use it in a particular way. And so then I decided to do something I don't normally do, was I told a personal story about being hospitalized and seeing the nurses discuss Facebook hour after hour after hour and show pictures of them. And the same person who was kind of leading the charge in rebellion against our messages said to me, well, how do you know it was Facebook? I said to my darling, I saw it with my own eyes. There's not much to not understand about that. What I did understand was in my 4-bed room, we hadn't seen a nurse for, I can't remember now, this was a couple of years ago, but it was hours. I started to keep track because I was going to have a little word with the manager at the end of my stay, which I did. Again, I think the patients needed the care, and you guys are up for a collective agreement renewal in next year. What is your manager having to spend their time with? So I find it really puzzling what people will allow themselves to do. Don't do it. Do it thoughtfully. Keep your personal life and your professional life as far apart as possible. And that's not even talking about whether it's a good idea to have a cell phone at work. You couldn't pay me. You couldn't pay me to bring this into a patient's room. I can't clean this. Why would I take MRSA, C. difficile, fungus home with me? Why would I do that? I wouldn't. So I think a lot more thought has to go into this than what I currently see evidence of.
If I would just add quickly to that as well, even if an employer decides not to discipline, charge, or terminate, the effect on your future is also can be fairly significant. Because as I mentioned in my presentation, quite a large percentage of employers now will check you out, your online profile before they hire you. So if they see something they don't like, as innocent as that might be, it may have a very direct effect on your future opportunities.
Okay, I'm looking at the time, and we do want to get concluding remarks. I'm going to see if Siobhan has one question online.
There's one.
This question is coming from Alberta, actually, so you're being viewed far and wide. And it relates to a discussion around social workers and use of social media to promote well-being, both professionally and privately, such as organizations use social media as a promotion tool. Whether there's a comment about that.
So if we could just have one comment. I mean, Elaine did point to that there are many good uses for social media. You know, we see those daily. Anybody want to make a quick comment before we move forward?
I will, because I don't know what this person means by doing it privately. And I would, short of knowing more, I would say don't do it. Unless you're self-employed and have taken advice about the privacy statute in Alberta, which does exist, and they have a very active privacy commissioner in Alberta, I would say don't do it. Be very careful about what you're doing and why. Your employer is undoubtedly doing a really good job about getting public health messages out. There are lots of agencies whose job it is, whose sole job it is to conduct public education. And so I'm heavily saying be very careful before you've checked out all of these things, because we look at the case scenarios, just these last two, and how innocently people went astray when what they did not intend was to go astray.
And just to follow up on that, I'd read an article one time where one of the strategies was, you know, if you're going to write something professionally and you have a professional Facebook page, for example, and you're sharing information about health and well-being, don't merge the personal in with that. So don't, you know, go write something about good, positive mental health and follow that up with, oh, I'm stressed, or I had this for breakfast. So really keeping those two, the personal and the professional, separate from anything like that.
Okay, thank you. And I'm going to move on now and ask Lisa to come up, and we'll just do concluding remarks very quickly.
We just have about 5 minutes left, and so I'm going to ask panelists to give me a 1-minute last thought to leave with our audience, because you've given us great information so far, and I am going to start with Sandy.
A couple of things I want to just conclude with. First of all, privacy is not something that we think about on a daily basis. I often tell people that privacy is like oxygen. We only really appreciate it once it's gone. You know, once you've lost it, then it becomes very important to you. But I will say that, you know, any use of the internet and social networking sites, there are two words that I use to describe it, and that's public and permanent. All right, once it's there, it's for the public to see. No matter how private you think your social networking activity is, I can guarantee you it is not private. It is public and very public. Even if you have all your privacy settings, you know, set to the highest point, you still have no control over what other people do with your information. So it's very much public, and it is very much permanent. Once it's there, it stays there. So your private versus your professional online profile is very much, the line between them is very blurred. So when you're online, I think it's impossible for you to separate the two in today's environment. The other thing that I would say as well is that, a lot of this is to me, is very much common sense. But the problem is that common sense is not all that common. Right? So a lot of people don't think about what they're doing, but if we just sit back for a minute and reflect on some of the things that we're doing and what the repercussions are, then we can avoid a lot of this.
All right, thank you very much. Tammy.
Okay. Just to reinforce that your standards, your organization policies, guidelines do apply, whether you're having the conversations in person in a boardroom or through a social media network, so be very cognizant of that. And as an employee, whether officially or unofficially, as I mentioned earlier, you're still a representative of the organization. So all employees should always consider how their online activity may impact upon the organization or upon the relationship with the organization.
Thank you. Elaine.
I'll just repeat a couple of things I said through the afternoon. So be friendly with your patients, not their friend. That's an ancient prohibition. Be be aware of anything that might lead your licensing body to think that you're bringing the reputation of your profession into disrepute. Slow down before you jump into things. I had a nurse once, I was lecturing, and she put up her hand and said, well, I don't even know what a blog is. And I said, well, then that's a very good place not to put patient information. If you don't understand it, don't. And I think many of us are in that world. It's very easy when you don't have a full-time job to stay on top of what's going on the internet. As soon as you have a full-time job in your life, it's a bit harder. So be wary and be careful to protect the investment you've made in your own career.
And finally, thank you, and finally, Annette.
Yeah, I guess similar to what my colleagues have said, but certainly just, to leave you with the message that I don't think, professionals intentionally set out to breach client confidentiality or to negatively reflect themselves online and harm their professional reputations. So I think it's important that we continue this dialogue, and from a very preventative point of view, and really drill down, okay, what are the ethical issues? How do we, develop best practices for addressing these issues? Because sometimes it's the subtlety and the situations that we don't feel are going to spiral out of control that can potentially be the more harmful situations. So in terms of being challenged to balance the risks and benefits of social media use within the realm of professional practice, to be aware of what ethical dilemmas we might face, how to protect our professional reputations, and how to develop strategies to manage some of the risks when we look at social media and intersect with professional practice.
All right, thank you. And I want to finish by saying and sincerely thanking our presenters, each of you, for, I think, continuing our tradition of excellence on these panels over the years. So we really appreciate that. And thank you for everyone participating both online and on site. As we leave the session today, continue this conversation with colleagues and know that as professional organizations, we certainly have resources on our website, which we hope will be helpful. Employing organizations do as well. So let's continue that conversation in terms of what we started today. And thanks again for attending.